Sitting #. You are talking to father of a 4-month-old baby, who has been diagnosed with bronchiolitis. The parent seems very upset. 1. Find out the reason for upset and reassure him about baby's care. 2. Explain bronchiolitis is a common type of chest infection. 3. Explain equipment is necessary: nasal cannula for extra oxygen, NG tube for food, oxygen probe to measure oxygen saturation. 4. Give information about bronchiolitis. 5. Reassure him about baby's progress and tell him about next step. Discharge only after taking feed and the oxygen saturation is maintained. Here, the setting is a hospital ward. So we can start our conversation by saying, "Good morning. My name is Sarah. I am one of the registered nurses working in this hospital. Am I talking to Mr. John, father of Jake?" Probably the father may tell you, "I am John." Then, as per our first task, you need to find out the reason for upset and reassure him about baby's care. So we can ask him like, "Mr. John, you seem very anxious. Could you, please share your worries with me?" Probably the parent may tell you like, "Well, my baby is just 3 months and hospitalized. So I'm really concerned." Then, as per our first task, we need to reassure him about baby's care. That is, we need to tell him about the best treatment and we are closely monitoring his condition. In that way we need to reassure parent. So you can tell him like, "It is understandable to feel worried in this situation. I know you are a loving father and you might be worried about your child's condition, but your baby is receiving the best treatment and he is frequently monitored by the doctors and nurses here. So there is nothing to be alarmed about your child's condition. Please be relaxed." In this way, you can reassure parent. Then parent may tell you, "Yes, I know you're giving him best possible care. But watching him with these equipments, it's bit distressing. Are you sure that he needs all this?" Then, as per our second task, we need to explain this: all equipments are necessary. So we can tell him like, "I do perfectly understand your situation, but your baby needs these all equipment. The nasal cannula helps him for the breathing by providing extra oxygen. If he's not using this, there might be difficulty in breathing. So it's really necessary. Also, the nasogastric tube would feed him because he is not able to feed from his mother, and the probe will measure the level of oxygen in his blood. So all these equipment, good for your baby. Try not to worry." Then probably parent may ask you like, "Nurse, I don't know how he become ill. What would have caused him ill? Was it my carelessness?" Then, as per our task, we need to reassure him by saying it's an infection of the lungs, commonly seen in children. So we can tell him like, "Well, Mr. John, I know how emotionally draining the situation for you. Please don't blame yourself. Your child is having a condition which is called bronchiolitis. It is a common type of chest infection in children. It is the inflammation of the bronchioles, that is the airways in the lungs, which is caused by viral infection. The virus may spread from the air itself. So you don't need to blame yourself for your child's condition. Please be relaxed. He's safe in our hands." Then probably he may ask you, "I hope my baby will be discharged soon. Is that right?" Then we need to tell him like, whenever your baby's showing progress, then he will be discharged. So you can tell like, your baby will be discharged only after he takes feeds from his mother and maintaining a good level of oxygen, and then he doesn't need all this type of support. How does that sound? Okay. Do you have anything to share with me? Probably, if there is no other concern, you can tell him, "Thank you, Mr. John, I hope I have addressed all your concerns. And if you need any help, let me know. I assure that your baby will be safe in our hands and I wish him a speedy recovery." In this way, you can end up this conversation.